For most people, the reason they need a joint replacement is due to arthritis. Osteoarthritis is the most common, but people with rheumatoid arthritis may also need a replacement of the larger joints if they become symptomatic. Some people may also need surgery because of a previous injury or if they have had a joint problem from birth or childhood. We will focus on osteoarthritis as this is the most common reason. In arthritis, there is the loss of smooth, hard cartilage which covers the joint, which can lead to some narrowing of the joint and exposure of some of the bone. Bony spurs can also develop at the edge of the joint. This additional growth of bone is not normal within this joint. The main complaint of these conditions is pain, and it will commonly cause poor movement and potential stiffness. In some cases, it may also lead to a difference in leg length. This can affect your walking and sometimes your ability to participate in your normal daily activities. What makes up a knee joint? A knee is a hinge joint and allows bending and straightening of the leg. It is made up of 3 bony parts, the femur or the thigh bone, the tibia and the patella, which is also known as the kneecap. There are a number of ligaments around and inside the knee and also cartilage within the joint, which help to provide stability. The knee has 3 compartments. The medial compartment between the femur and the tibia is on the inside of the knee, and the lateral compartment between those same bones on the outside. Then the patellofemoral compartment lies between the undersurface of the patella and the front of the femur. Just like the hip, the knee also has a shiny hard cartilage that covers the joint surfaces, allowing smooth movement. It also has menisci. These are ring-shaped thicker cartilage that sit between the femur and the tibia on both sides, acting as shock absorbers for the knee. With a total knee replacement, an incision is made over the front of your knee. The femur and tibia bones are trimmed and metal components are placed over these trimmed ends. A high-density plastic component is fitted between them. Sometimes the undersurface of the patella is also replaced. Whilst the muscles and surrounding tissues are healing, it is important you follow these restrictions to minimise the risk of damage to your new joint. Avoid twisting or pivoting on your operated leg and avoid kneeling directly onto your operated knee.
How can I prepare for surgery? The occupational therapist, or OT, will contact you by telephone approximately 2 to 3 weeks before your surgery to discuss your current living situation. They will ask how you are currently mobilising and managing your day-to-day tasks. We will also ask you about any support you will have available to you on discharge or what support you need after your surgery. We advise that all furniture that you sit on after your hip surgery is set at a height where your hips are a little higher than your knees to make sure that your hip remains at a safe angle. Measure the heights of your toilets, chairs that you will be using and the height of your bed. To measure a chair or bed, sit down on it first as some furniture compresses when sat on. Then measure from the floor to the top of the cushion or mattress. We will need to know what type of furniture it is and what type of feet it has, so please take note of this when measuring. To measure the height of your lower leg, sit on a chair and using a firm tape measure, measure from your heel on the floor to the back of your knee. If you normally wear shoes or slippers indoors, measure these with shoes and slippers on. Otherwise, measure without your shoes. If you have a relative or friend who can measure this for you, you may find this easier. Equipment such as toilet frames, chair raisers and perching stools can be provided if needed, and these will be delivered to your home prior to your surgery following our phone call with you. On occasions, some pieces of equipment can be issued on the ward for you to take home with you if it has not been identified in advance.
In this short video, we will demonstrate how to use long-handled aids to help you get dressed after your hip surgery. The OT will advise you on where to purchase these before your surgery. When putting on trousers or skirts, sit down on a suitable height bed or chair and lay the item of clothing out over your lap. Using a long-handled grabber, gather up the waistband on the side of your operated leg and lower it down so that you can bring it up over your ankle. If you have had a hip replacement, remember to avoid bending or twisting your operated hip as you do so. Bring it up to the point where you can reach it without bending. Now use the grabber to dress your other leg. This is usually easier as you are not restricted on twisting or bending this leg. Once both legs are in, you can stand up to pull the clothing up fully. To undress, complete the process in reverse. In this short video, we will demonstrate how to use a sock aid and long-handled shoehorn to help you get dressed after your hip replacement or surgery. Putting on socks can be slightly more difficult. There are different varieties of sock aid, but essentially they are a gutter with two long strings attached. Stabilise the sock gutter between your knees. Now put your sock onto the sock aid, imagining that the sock gutter is your foot. So the heel of the sock should be underneath. Put it on as far as you can. If you have a softer sock aid, you may need to stretch the gutter as far as possible to make it easier to pull on. Holding the strings, lower the sock gutter down and gradually ease over your foot, remembering not to bend at the hip. Gently ease the sock gutter over your foot and pull up. You may find it helpful to point your toes to the floor whilst you do this. This does take some practice, and some styles of sock gutter are easier than others. A wide, firmer gutter is usually easier. To remove the sock, the easiest way is to slide a long-handled shoehorn down the back of your leg and push the sock off. Use the helping hand to reach for your shoes or slippers. Slip-on shoes are easiest to prevent having to bend to tie laces or manage Velcro. A long-handled shoehorn can be helpful for putting these on.
Start your physiotherapy exercises shown in your booklet so you become familiar with them. It is beneficial to gain as much movement in your hip or your knee and to strengthen the muscles in your leg before your surgery. This will help speed up your recovery time and may improve your symptoms before surgery. If your symptoms affect your mobility, it may help to use a walking aid to stop you limping and reduce your pain. Check your walking aid is in good condition. Preparing in advance of your surgery will make things easier to manage. If you normally make your own meals, you may find it helpful to prepare meals in advance that could be kept in the freezer. We encourage people to try and regain independence with tasks such as cooking over time, but this may help you whilst you are getting used to your walking aid, such as crutches or wheeled Zimmer frames. Some people choose to use ready meals for the microwave or oven as an easy option after surgery. These can be bought from a normal supermarket, or the OT can advise you on meal services that are available. Following your surgery, you will be advised not to bend or twist your affected hip. This can make doing tasks in the house a little trickier, and some pre-planning can really help with this. Where possible, try to rearrange things in the home so that you won't have to be bending too low. For example, in the kitchen, you could move things to higher cupboards, or you may choose to keep some crockery or dishes out on the work surface for easy access. If you have a low fridge or freezer, try to keep food you will need in the top shelf.
Please limit how many items you bring with you, as there is very little storage space on the ward. What to bring to the hospital? Well-fitted, flat, non-slip footwear, slippers or trainers. Shoes with no backs are not advised. Nightwear, for example, a night dress, loose pyjamas or baggy shorts and t-shirt, so these can fit over dressings. Loose daytime clothing. We encourage you to get dressed and wear your own clothes as soon as it is practical. Personal toiletries, shampoo, deodorant, shaving items, flannel, toothbrush, toothpaste, towels and sanitary wear. Glasses if required. These are preferred to contact lenses as they are easier to take care of and less likely to get lost in hospital. Dentures with a denture pot, hearing aids plus spare batteries if required. Please bring in any medication you are taking in its original packaging or blister packs, including any that you may have been asked to stop prior to surgery. Please ensure you have enough to last your whole stay. A book or magazine, mobiles and tablets are allowed on the ward. Please remember to bring your chargers. Please also remember your Enhanced Recovery Programme booklet and any other paperwork that is relevant. Also remember, if you have any long-handled aids, to bring them with you. These can be used as soon as possible to allow you to be as independent as possible. Please arrive at the reception of the Sussex Orthopaedic Treatment Centre at the time specified during your telephone call 48 hours earlier. Once you have informed the receptionist you have arrived, you will be asked to take a seat in the reception area, where you will wait to be called by the admission team. Although every effort is made to ensure that your waiting time is kept to a minimum, we cannot guarantee times. It is therefore advisable to bring something with you to keep you occupied. Your bag will be kept safe in recovery and you will be taken through to the pre-operative area. Here you will be assessed by a nurse and anaesthetist to discuss your surgery. You will walk into theatres where your anaesthetic will commence. In recovery, your observations will be monitored to ensure they are within normal limits. Following spinal anaesthetic, normal leg function will recover after a couple of hours. Your privacy and dignity will be maintained. The recovery nurse will be with you constantly to ensure that you are recovering from your anaesthetic and that your pain is well managed. You may feel a little disorientated and sleepy, but when you are awake and able to start moving your legs, you should start your early hip and knee exercises, which your recovery nurse can help you with. You will spend approximately 1 to 2 hours in recovery. Once you are comfortable, you will be offered something to eat and drink and then transferred up to Newark Ward. You will be offered something to eat and drink shortly after your return to the ward. It is important that you try to eat and particularly try to drink fluids regularly after your operation, as this will aid your recovery. Following your spinal anaesthetic, you might have trouble passing urine and a catheter may be required temporarily to help this. This should not prevent you from continuing your rehabilitation. A joint replacement is major surgery and it is anticipated that you will experience pain after the operation. This should be a different type of pain than before your surgery and improves over time. You will be prescribed suitable regular pain relief to help with this. You will also be prescribed additional pain relief should it be needed to aid with your rehabilitation. You must specifically ask your nurse for this, although they will regularly ask you about your pain. Some of the medications that you are given can make you constipated. Keeping hydrated and mobile will help relieve this, but you may also need some medication to aid bowel movements. It is not uncommon to feel sick after your operation. The nurses can offer you some anti-sickness medication to help with this also. Just let them know. You might need to have blood thinners after your surgery, which is usually an injection called enoxaparin. For a total knee replacement, this is usually for 2 weeks, and after a hip replacement, 4 weeks. Your nurse will teach you or a relative how to administer these simple injections yourself, if it is appropriate. Occasionally, your consultant may decide that alternative medications are more appropriate for you instead. Developing a blood clot is one of the risks of surgery. There are a number of measures we take to reduce the risk of deep vein thrombosis, or a DVT. You may be prescribed anti-embolism stockings. These could be applied on one or both legs, depending on each individual case. If these are used, it is likely these will be taken home with you. It would be helpful if someone is available to help you with these once you are home.
On the first working day after your surgery, the occupational therapist will see you on the ward and check that all the information we discussed with you before your surgery remains the same. We will check you have all the equipment in place that we discussed you would need, and will talk through with you any concerns you may have at this point. The OT will assess you doing functional tasks once you are up and about with the physio if there are any areas you are struggling with. For example, if you are struggling to get yourself washed and dressed, we will work with you to look at any difficulties you are having and make plans with you regarding any additional support or equipment you may need. It is not unusual to require the additional pain relief before your physiotherapy, and it is expected that you will take it as required to enable you to do your exercises and mobilise. The same pain relief does not suit everyone and is not always effective for each person. Our acute pain team are on hand during the week and can suggest alternatives that may work better for you. Remember, at this stage, pain is not a sign of damage to the new joint. Depending on when you return to the ward, your nurse or physiotherapist will aim to get you out of bed on the same day of your surgery or the day following. It can be helpful to ask your nurse for additional pain relief before you do this. Often with your mobility, the physiotherapist will start you walking with a Zimmer frame. It may be dependent on your level of mobility, but usually the physiotherapist will teach you how to use crutches. They will also advise you on normalising your walking pattern, known as gait. Before you go home with these crutches, they will ensure that you are independent. If you have stairs at home, or you're likely to encounter them during your recovery, the physiotherapist will teach you the best way to do stairs, using rails and crutches as necessary. You'll be discharged 1 to 3 days after your surgery. On the day of discharge, a nurse will explain everything you need to know before you go home. It is expected that you or a family member will change your first dressing. This is usually 7 days following surgery. Following this, you will visit your practice nurse. They will review your wound and apply another dressing if necessary. On the day of discharge, it would be really helpful if you could arrange your friend or family member to collect you before 11:30. This enables us to get the patients having surgery that day in on time. If you are collected by your friend or relative, they will be able to come up to the ward to help you with your bags. They will be able to park in the spaces directly outside the building. You may find it easier to have an additional cushion to sit on in the car if the seats are fairly low, especially when keeping to your hip precautions.
Getting into a bath is not usually recommended post-surgery, especially sitting down in the bath. If you have a walk-in shower or a shower cubicle, this is ideal. If you find standing in the shower difficult and your shower is large enough, the occupational therapist could issue you with a stool for the shower. If you do not have a suitable shower, it is usually best to have a wash by the sink. Some people find a perching stool suitable for this, as shown in the picture. If you have been assessed by the occupational therapist on the ward and your balance and mobility is good following your surgery, you may be supplied with a shower board which sits across the bath for those with a shower over the bath. To use a shower board, make sure the board is directly behind you before sitting down. Sit as far back as you can on the board, keeping your operated leg slightly in front of you. To avoid bending at the hip, you will need to be able to lean backwards before bringing your operated leg over the side of the bath. Ideally, keep your operated leg out in front of you and don't lean forward when sitting down. Making drinks and meals will take a little bit of practice after your surgery if you are not familiar with using a walking aid. If you are on crutches or walking sticks, you will need to stabilise these whilst doing jobs in the kitchen. So stand them up in a corner, or you can hang them on the work surface, making sure they won't slip down. Then you can use the work surface for support whilst making a drink or preparing food. If you have a work surface around your kitchen, you can step around using the surface for support rather than using your walking aid if this is easier. Some people find a perch stool helpful in the kitchen so that you can sit down whilst preparing food and drink. You can also use this to sit down and eat your meals. If you need to carry your food to a table or another room and are using a walking aid in both hands, you may find it helpful to have a kitchen trolley, although this will be assessed on an individual basis once you are on the ward, as they won't be suitable for everyone. Remember not to twist as you turn to the trolley. If you need to bend down a little way to reach the higher shelves of the fridge or a low cupboard, you can stand sideways against the work surface and stretch your operated leg out behind you so that you maintain a good angle at your hip. You should only do this if you have good balance post-surgery.